Hello, I want to give you an update about the COVID vaccination programme for HSE staff. Firstly, I want to thank you again for your ongoing commitment to providing healthcare to the people who use our services, especially during the last year. The last month in particular has placed great demands on staff in hospitals and in communities, and thankfully we are now seeing falling numbers of cases which will ease pressure to some degree in the coming weeks. We are close to completing the vaccination of the first of the government's allocation groups. That group is people in long-term residential care settings and staff. This is a significant milestone as we move to protect some of the vulnerable people in our society. We will be going back to offer the vaccine again to people in Group 1 who are not able to take the vaccine in the first round. The second group is frontline healthcare workers. Many of you who are frontline healthcare workers have had the vaccine already. I know it has been a frustrating wait for those of you who have not got the vaccine yet, and I want to assure you that we are committed to completing the rollout of the vaccine to all of you who are frontline healthcare workers as quickly as possible. This week we also started to roll out vaccination in community settings with people who are 85 or older. People in that group will be called at clinics by their GPs. This will take about 3 weeks to complete, and we will then move on to people who are 80 and older. Based on expert advice, the Minister of Health has directed that people in this group should be given one of the mRNA vaccines, that is the Pfizer and Moderna vaccines. So the HSE is using the supplies of mRNA vaccines we have for that group of people. We are now seeing the third approved vaccine, the AstraZeneca vaccine, being delivered in larger quantities. This enables us to roll out this vaccine to frontline healthcare workers right away. With further supplies arriving throughout February, the majority of frontline healthcare workers should be able to receive their first dose in the coming weeks. 2 to 3 weeks after the first dose of the vaccine, a person has a much reduced risk of COVID-19 infection and of serious COVID illness. Data just released on AstraZeneca shows 76% efficacy and no decrease in immunity for the first 90 days after the first dose. Vaccine efficacy was 82% after the second dose, with a 12-week interval between doses. Because this longer interval resulted in the highest vaccine efficacy, we will be using that interval for people under 65. The AstraZeneca vaccine is the first to report that will not only protect against symptomatic COVID-19 disease, but may also reduce spread of the virus. So we know it can help to protect you, your family, and the people you look after at work. I encourage all healthcare workers to take a COVID-19 vaccine when it is offered. For healthcare workers who are not in direct patient contact, we will be in contact with you. Please remember that you get no protection from a vaccine the day you get your first jab. It takes 2 to 3 weeks for your immune system to work on the vaccine before you have any protection. Even if you are fully vaccinated, you must continue to follow the public health and infection prevention and control guidance. Keep your distance, maintain hand hygiene standards, and wear the appropriate PPE. Please keep up all the precautions until we get back to you. Thanks again for your dedication and commitment over the past year. The vaccine rollout programme is bringing our teams, our patients and our families much needed hope after what has been a very difficult year. Scush dóchastín go bhfuil dilín na vaccine is amachar fud na tíre, tá sin níos táit ná riú, go glímuid go daingan leis srínta poblí. Arís, muoine buchas as ocht for sihir. Bígi dóchasach agus bígi slán, gur na maigah.